Hello and welcome to my advanced myoskeletal alignment for low back, hip, and leg pain video series. I usually like to get in on them with my thenar eminence and do the same thing, pushing the spinous processes that way because that's the way they need to rotate anyway, right? So I'd be pushing the spinous processes, and I can kind of push through it like that, but it's not as effective as someone who can actually get your fingers on the bodies of the spinous process. However, if you find a single joint dysfunction, non-neutral dysfunction, and here's something that's not wanting to swings through, go ahead, but look, watch my hands. They're not moving. There's none of this. He's not counter-rotating. Going out. What's happening when I'm doing this right now to the iliosacral joint? Posteriorly rotating the iliosacral joint. What does she have a problem with? Posterior rotation of the iliosacral joint. That was her problem, right? Because she was anteriorly rotated, inferiorly rotated. We're posteriorly rotating it by pulling it out. When you compress the joint, what do? You anteriorly rotate it. Always leave them, unless they're flat back, flat butted, you want to always leave them in distraction because pull a twist to it. I like to do piriformis like this, but I don't like to get in on the sciatic notch and push on the sciatic nerve. I don't like to get anywhere on the gluteus maximus where I'm lengthening or loosening the gluteus maximus, and you really can't get piriformis here. You can only affect piriformis here through the other tissues. But if you get right on the sacrum, right on the sacral, long dorsal sacroiliac joint, notice how my arm is in a longitudinal direction with her body, and then I glide right off, but I want to be just telling you, is that okay with you? Get their permission, is that okay with you? And why is because when you get up to that pubic ramus, you want to rock along the whole pubic ramus because it's not only the adductors you're affecting, but it's the levator ani. Remember that the levator ani has three different parts of that muscle that form the pelvic floor. The pelvic up, putting a lot of force through here, and relax. And one more time, and relax. Okay, that's good.